Health officials are reminding people that the risk of spreading coronavirus in a community remains very low. But would you know what to do if you suspected you had the virus? Many people might think they should be rushing to the nearest hospital or doctor's office, but health officials say otherwise. What would you do if you thought you had coronavirus?
Or go to the nearest hospital.
Wrong.
Stay home.
Stay home?
Yeah.
What's the next thing you would do?
Call my doctor's office.
Ryerson University's Associate Professor of Nursing, Nancy Walton, says don't go to the hospital right away. The emergency is for people who are really sick, not for those who have common cold symptoms.
Call your healthcare provider. Call your family doc. If you can't reach your family doc or your nurse practitioner, call Telehealth Ontario. They can give you lots of answers there. They'll ask you some key questions that'll help you understand the next steps. Don't just show up at your healthcare provider unannounced, and you should self-isolate.
By now, most people know the symptoms.
Things like the flu, coughing, sneezing, fever, chills.
Here's how to avoid exposure. Limit physical contact with people.
It's important to remember that viruses that are out there can't just walk into your body. They need a way to get in. So when we rub our eyes or touch our nose or our mouth, that's a nice way for viruses that are on our hands to get into our system.
Are you shaking anyone's hand?
Always.
Always, yeah. Yeah, you too?
I'm a recruiter, so I'm shaking people's hands
Shake it, but then do you wash them right after?
Right after. Definitely.
Smart. And if you think getting a mask is a good idea, it's not.
One thing is you'll see a space between the masks and people's face. And
right.
That's where the virus can get in. The second thing is if you're not used to wearing a mask all the time, so if you're not a nurse, you're not a physician, you're going to be fiddling with it. So you're going to be touching your face more. So no, masks are only recommended if you are sick, you have symptoms, to prevent the coughing and sneezing that you're doing on getting to other people.
Health officials say the best thing to do is wash your hands with soap and water frequently for 20 seconds. But if that isn't an option, it's a good idea to keep hand sanitizer with alcohol in it. The only problem is a lot of people use hand sanitizer incorrectly. They simply put it in their hand and rub it. But what you really want to do is make sure you get the backs of your hands in between your fingers as well as your wrists, and keep doing this until it's completely dry. Maleeha Sheikh, City News, Toronto.